Hey, ladies, how's it going? Hope you're having a great Wednesday. Welcome to Wellness Wednesday. Want to make sure everybody can hear me and see me okay? All right. Looks like we're good to go. Very good. Hope you're all having a great day. I'm excited to meet with you tonight. I always like answering questions. Uh, I don't know what it is. You guys have a lot of good questions, and I really just want to give you the right information so that you are better in control of what's going on in your body. And you can only do that when you have the right information, right? That's so important. So we are going to dive into that. I am going to say my disclaimer first of all. Okay. Yes, anything that I say tonight versus during this Wellness Wednesday is merely health information and not health advice. So do not start taking, don't stop taking, or change the way you're taking any of your medication. And if you do feel like you need to do that, please first consult with your prescribing practitioner so that they can help you make those adjustments safely. And trying to get this open for me. And of course, by attending this Wellness Wednesday, unless you already are a patient, this does not establish a doctor-patient relationship. And I just want to know how everyone's doing. I mean, is everybody ready for the holidays? I hope you've had I hope you've had some good time with your families, your friends, as been going through this. I've talked to a lot of patients recently who have told me that they've done so well with making the right choices during these holidays, and looking forward even to, the Christmas and other holidays in December, looking forward to keeping up their streak, right? Um, but of making good choices, of making the right food choices and drink choices, and they want to. It's almost like they've had I don't know. It's like a challenge, right? It's like a challenge for themselves to, um, to really keep it going. And I mean, it's obvious that they are motivated to change the trajectory of their health. So it's so awesome to hear that. Um, you ladies have asked a lot of questions, and so I'm excited to get into the answering those. I'm gonna try to go rapid fire through them because you did ask a lot, even just for tonight, and so yeah, let's get going. So and no question is a bad question. Okay, I want you to know that. I am really encouraged, and if you have questions that come up tonight as you're watching and listening, I am going to save some time near the end to answer some of those questions as well. So Carolyn asks, is a modified paleo diet for stage 3B chronic kidney disease and thyroid? Um, I am going to answer this diet question this way because there is no one diet that is good for just any sort of condition. That is a myth. There are there are so many nutrients that we need in good foods, in high density nutrient vegetables, in meat and fish, in foods that provide healthy sources of fats. These are all helpful for us, and I'm not ever going to say that there's a diet that is the most helpful for a particular condition, because it really isn't true. All right. There's a lot of misinformation out there. So the key, and this is, let me back up. There's a lot of information out there because people that want to provide you information want to give you some information, and usually it's to help benefit them, right? Usually it's for a reason, and so they're going to give you. I mean, it's not always the case, but they're going to give you information, and it's going to be geared toward the masses that ask the question, and and frankly, they also may not have the experience to really have the right answers for this, especially related to this question about what is the proper diet. Um, so it's it's important that we realize that everybody has different needs. Yes, we have the same physiology. Yes, we are all humans, and it's important to recognize that. But we are not. So we don't all have the same food sensitivities. Not all of us are sensitive to foods. Um, we don't all have the exact same, nutrient needs at any given time in our lives because we're also, we're all different stages of health and stages of nutrition. And so it's it's not fair to say that a group of people with hypothyroidism all need a specific diet. A group of people with Hashimoto's all need a specific diet. You can't say that honestly. All right. So what we do need to do is know how to help you customize your diet. That's what's most important. We really do need customization of care in order to help you reach your health goals. So, um, modified paleo may be good for many people with these conditions, kidney disease, thyroid conditions, but I'm not going to tell you that that's exactly what you need because I don't know. We would have to help you customize your diet. Next question. What markers show you are getting and digesting and absorbing glutathione? So, just a little bit of information. Glutathione is the body's most abundant free radical scavenger. So it helps with inflammation. And there are tests. There's the intracellular RBC glutathione is helpful. You can get a serum level of glutathione, but really the most and then there's a ratio that you need to get with another test, and I'm forgetting about it right now. Um, we really don't ever need to usually get those kinds of tests when we're seeing, especially when we're seeing improvement in your function as a result of giving you glutathione. And while it is possible to get toxic with sulfa groups, it's really difficult. It's really difficult. So we really don't have a need to test for those a lot, but it is possible that we could test for that. What tests show that my body is digesting and utilizing nutrients well? Um, there are, I mean, even just getting in the comprehensive testing, liver enzyme tests, total protein tests in that comprehensive metabolic panel. Um, there's homocysteine, MCV, so markers that are already included in a complete blood count. If you know what to look for, you will know that you're getting better nutrient rich, I should say, right, in your bodies, especially if you are, making progress. And sometimes it happens this way because you might be really reversing your symptoms and you're feeling a lot better, but then your blood level of certain nutrients might go down. And that seems counterintuitive, but blood levels are really only what's in the blood and not what's in your tissues. So sometimes we see a magnesium go down, for example, when someone's neuropathy is really improved, right? They're really improved, or their sleep's really improved, their anxiety is really improved, and we see that, kind of a lower magnesium level. This is likely because we're catching that at that point in time in a blood sample, um, where it's more in the tissues and less in the blood at that given time. So it's about thinking about it's all about thinking through the context. All right. How do you specifically discover where an infection is in our body? Are there certain tests to pinpoint where they are, what they are? Sometimes there are tests, yeah. Nasal swab tests help us to see if there are multiple antibiotic resistant, bacteria in the sinuses, if there's yeast or mold in the sinuses. So we can do nasal swab testing. We can do stool testing to see if there are bacterial overgrowth types of situations, yeast, parasites that are in the gut. Um, Sometimes we need to correlate lab findings with symptoms. So joint pains associated with certain findings, certain inflammation markers. Uh, so we can pinpoint where those infections might be. Sometimes it's not necessary. Sometimes we just know that you're dealing with uh, a bacterial pattern of infection, and treating that with something natural can be helpful as you're really working on everything else. Okay, that's important. So during a customized care plan, that's the ideal scenario. Dr. Redd, during the next master class, uh, Bobby asks this, will you share with us how test result ranges are formulated as opposed to how the optimal range differs? I do talk about that during the master class. I can tell you briefly that lab ranges that you see on your lab tests are based statistically. They're only based on statistics. So they take a data set, all these people that are tested, for, whatever it is. So say a CBC, a complete blood count, and they get all the data for everybody that's got a CBC, and data accumulates with time. So more and more data comes up. And what they're seeing then is they're looking at the mean findings, and then they're going two standard deviations from that mean, and there's your range. That's really all they do to find the standard lab ranges. It's only a statistical analysis. This misses a lot of things. It misses dysfunction. This is what doctors use to identify disease. And I, as I've thought about that, it doesn't make a whole lot of sense because, well, they are testing those people with illness, with symptoms, with disease. So when they see that there's a number outside of that range, then it is closer to being accurate for disease. But when it comes to figuring out if there's dysfunction and the number is still normal, that doesn't tell us anything. And so we have to study this. And so optimal ranges are I mean, these are researched in functional medicine, and we know that there are more narrow ranges for super optimal range findings for so many tests, right? We've studied these things a lot in functional medicine. So that is how the ranges are identified, are established, and it varies, determined by geographic location and data within that geographic location, lab data. So it could be different on the East Coast than on the West Coast. I mean, it's really interesting. Okay. Pam asks, is there a probiotic that you recommend? And if this is you, Pam, who's a patient, then this may be a better question if you're figuring out if you need a probiotic to ask your coach and provider. But in general, uh, there are some really good probiotics out there. As far as what you can get commercially, um, there are Now brand would be like one with, but they would keep it refrigerated with that gives you a lactobacillus. Um, Bifido, I believe the same brand carries one that has bifidobacterium and a lot of different ones. But really, you got to go with a more reputable company, and we typically can only prescribe those to you as practitioners. So there are multiple, and they are determined, really best determined by getting the right testing. So comprehensive stool testing would be um, really essential, which is, a test our patients get after they become a patient as we're working, helping them work through a customized plan. So the stool testing is vital to see, well, what bacteria are missing, and then we can have a better idea of which probiotic to get if they are indeed in need of probiotics. So not everybody needs them, right? And it sometimes they can do more harm as far as cause other symptoms when you don't need them. So um, I know there seem to be all the rage, right? But they're not always needed. So, all right. Um, Sandy says, thank you for the information. Can you talk about brain rewiring, heart math, yoga, and how they benefit our adrenals? I am only scratching the surface of what brain rewiring is. When I sit quietly, breathe, and close my eyes and visualize calm, I feel a sensation in my back as if my whole system is benefiting. It feels like the food my adrenals are begging for. And I love that. I love that. Um, so our adrenals are the glands on top of our kidneys, right? That um, are so helpful in many different ways. They make so many hormones for us. They make hormones that help us balance our electrolytes and fluid levels, blood pressure. They make hormones that help us to, make certain hormones like the sex hormones, estrogen and testosterone. They make the stress hormones, cortisol, and they make epinephrine, norepinephrine. So these and others. Adrenals need, so the adrenal glands are associated with the sympathetic and the parasympathetic nervous system. In fact, all of our glands have an association with the parasympathetic and the sympathetic nervous system. The autonomic nervous system, which is divided into those two pathways, two different pathways, is the part of the nervous system that controls things that you don't have to think about, like your digestion, controls your breathing. Just you sitting, I mean, yes, you can control your breathing, but you don't control it, on a baseline level. The part of your nervous system that really just keeps things functioning behind the scenes. Okay, that's the autonomic nervous system. So where heart math, yoga, come in is they help to strengthen the parasympathetic nervous system. The sympathetic nervous system is what is almost constantly stimulated in our lives. That's known as the fight or flight nervous system, right? Fight or flight part of the nervous system. Or freeze, right? Fight or flight or freeze. And it's really detrimental if you stay in that and if your balance is shifted more to that sympathetic side. The parasympathetic side is the rest and digest and repair part of our nervous system. And so uh, we we don't stimulate that as much as we should. And that's where yoga and meditation and heart math all come into play. And using those tools, deep breathing is another one. There's vagus nerve stimulation exercises. Um, and when we use those tools, we can balance our nervous system better. Then our adrenals don't have to help us with stress so much because we're able to better handle our stress. It's almost like let's think about it this way. When you're dealing with the stress and the sympathetic systems on overdrive, it's like you're in the trees, you're in the forest, battling everything that comes at you. You're only focused on the minutia, the details in the trees. When you're strengthening your parasympathetic nervous system and balancing that, it's almost like you're able to rise up above the forest of trees and survey things calmly. Like, let's not get bogged down in those details right now, but let's get over things and see be better able to triage is a term you might be familiar with. Really make balanced and informed decisions based on everything that's going on in that forest for you. That's the best way to think about this. And so, I mean, it's comforting even thinking that can happen. And I think that that's what she means. So she feels this sensation, almost like she's able to rise above the the minutia, the stressors that you really can get away from if you're able to get, customized care to help you take care of your symptoms, help you reverse your symptoms, the fatigue, the brain fog, the memory issues, the sleep issues, the decreased stamina, right? Um, any other symptom, the weight, the excess weight, right? Helps you deal with all these things a little bit better. Okay. And it requires customized care. And that's part of it. All of those things help you to rewire your brain in a way that you can think differently about things and and therefore uh, get unstuck. And I do talk a lot about this in the master class, and and that's such an important topic. So um, that's a good question, really good question, Sandy. Missy asks, can there be pain in the adrenals? She kind of talks about standing too long, maybe during cooking, and she feels some pain in the back on the side, and it feels like it's around her kidneys. Well, you can have kidney pain. I don't necessarily think that you can have adrenal pain unless there's something being stretched, like if there's a tumor, if there's a. I mean, even then, I have not heard. I think it would be more rare for you to have pain associated with adrenals and even kidneys, unless, like I said, you have an infection. Uh, Kidney pain can certainly be caused by infection, like a kidney, a UTI that spreads up into the kidneys. Darlene asks, can you have ashwagandha and sea moss with hyperthyroidism? I would definitely avoid both of those in hyperthyroidism. Uh, Bobby asks about fragrances. Are you talking about perfume, which I love and wear every day? Would you help us better understand what we should be using in place of the over-the-counter perfumes? So I'm not thinking there really is a replacement, because perfumes are all chemical. They're all, and some people are very sensitive to these. And even if you're not necessarily knowing you're sensitive to these, they can be detrimental and cause chemical toxicity within your body. So they can absorb certainly through the skin. Of course, when you inhale and breathe the fragrance in, these chemicals can have an impact on your whole system, and can be detrimental to your health. Okay. Rodora asks, einkorn flour sourced from Italy. Can we use this eventually to make sourdough? I'm fine without bread, but hope I don't have to wait till my last day on earth to have sourdough toast with orange marmalade. I think the real problem is the orange marmalade. That's where there's going to be a lot of sugar. But ladies, uh, gluten is gluten. Now, we do grow different wheat here in this country. Einkorn from Europe is uh, more of it's the old world type wheat, and it has not been hybridized, and it's probably better for us. But those of us with Hashimoto's and sensitivities to gluten, with inflammation, with blood sugar issues, it doesn't matter that it's gluten from Europe or gluten from wheat in the United States. That wheat still has sugar, glucose, fructose. This is the biggest problem for so many of you ladies. Make no mistake, when the problem most of you are dealing with is insulin resistance and a blood sugar issue, it is not okay to eat these foods. I don't know if you're going to have to wait till your dying day to have that. You can certainly make choices. And it's probably better to, cheat with that kind of, I say cheat or choose that kind of wheat rather than the wheat we have in this country. But when you're trying to get better, why sabotage yourself? Why take a risk? Let's get the inflammation gone, and then you can, in a sense, what you're doing is you're building up your health account, and then you can make a withdrawal here and there. Okay. Um, that's how we've got to think about this. So go through your process, right? Get this Hashimoto's and other autoimmune disease that you may be dealing with, ladies, into remission. Reverse your symptoms. And then you can choose to eat off plan. And that's probably better to utilize that kind of flour than the flour from here in this country. Suzanne, can Tourette's or vocal or muscle tics be caused or made worse by autoimmune diseases, food sensitivities, food allergies, Hashimoto's, thyroid, or gut imbalances? And the answer is yes, because they affect the nervous system. All of those can affect the nervous system response. Doctor, Christina asked, Doctor, how much is the entire panel if we go through you, please? It depends on which panel. There are a couple of panels. Attend the master class, and I will talk more about the the blood work and what the costs are there. I get a really good deal because I'm part of a co-op, and so you don't have to, you know, pay out so much out of pocket when insurance doesn't cover these tests. All right. Let's see. Diane asks, is there any documentation on 5G and DHEA rising in people? To be honest, I don't know about that at all. I know about 5G. I have never heard of it causing DHEA to rise, um, other than it might rise when you have insulin resistance. And certainly 5G could cause some problems with insulin resistance. So I guess in that sense, that could happen theoretically, but I haven't seen any research necessarily. I haven't seen any research on it. Um, Bobby asks, why do we twitch in our sleep? And, so there's a couple of different um, reasons for that. Like when you're transitioning from, wakefulness to sleeping, your breathing slows and your heart rate drops and your muscles relax suddenly. And this rapid shift confuses the brainstem sometimes and can trigger a brief like motor burst, which ends up being like a twitch. And certainly the more overstimulated your nervous system is, like from caffeine or stress, if you're drinking caffeine, especially later in the day, that can, or maybe when you exercise later in the day, the more likely your brain is to, like overreact, like to twitch, during that wake sleep transition. And that'll be, it's like it'll give you a jerk. That's generally what that is. And someone else asked that question too. So, okay. Um, Mary says, I have had diverticulitis for years. I've been suffering with colon cramping in the last year after a recent colonoscopy. Saw possible signs of Crohn's um, and overuse of NSAIDs like ibuprofen, aspirin, things like that, which I don't take. Parasites maybe as well. The doctor ruled them all out, gave vague reason, handed me some pills for cramping, and called it a day. The doctor didn't really rule them out. That's the kicker here. All right. And they're not getting the right tests to actually rule these things out. And that's why comprehensive testing is absolutely essential. And I do go over what that is in the masterclass. Anne asks, let's see. What are your thoughts on Manuka honey? Well, it does have health benefits, but I would definitely not be eating any sort of honey when you have a blood sugar problem, period. It's going to make it worse. If you're working on reversing insulin resistance, Manuka honey is not. I wouldn't recommend it because it is honey, regardless of what kind of honey it is. And I know it has some extra benefits, but this is not going to be appropriate for you if you're dealing with those issues. Surely all of this poking with needles cannot be good for an already inflamed thyroid gland. If there are any cancer cells, the nodules will seal them off, prevent the spread, but the needle biopsies open up that protective seal. Am I right? You are right, but there really is no documentation or any studies that show any overwhelming problem with this. That is a very, very rare occurrence if that were to really spread any cancer cells from that needle. It can happen, but it would be a very, very um, rare thing. I even saw, because I am into thyroid, right? There's like a less than 0.005% chance. Okay, there are a couple of case reports, but they are exceedingly rare. Okay. Um, it's called seeding, and it's really subclinical, and these cells end up just dying or being cleared by the immune system. And you know, there really is no credible study to show that needle biopsy worsens overall survival or increases what we would call like metastasis rates in any common cancer, ladies. There really is no, um, you know, thing there. There may be specific cancers where this might be more of a problem, but especially for thyroid, it is not. Um, all right, so let's go on to the next one. Do frequencies that are added to water really work? I don't know. I don't know. Your guess is as good as mine. I really don't know. That's not something I've ever tried. I haven't really seen any, yeah, never really seen any information on that. Um, some of you ladies, you scour that internet. Dr. Google provides a lot of interesting stuff, but I know there is power in energy in frequencies. I appreciate that. I'm not one to discount that, but the honest answer is I don't know. Okay. Kathleen asks, I'm curious about coffee. Is it the potential mold or the caffeine that's the main concern for eliminating it from our diets? Yes, both. Mold, coffee is high in mold, and that is a risk for so many of you who are likely dealing with mold toxicity. Caffeine causes cortisol spikes, and so cortisol will cause insulin resistance to worsen and cause weight gain when it's high a lot. So yes, even drinking coffee can cause weight gain. Yep. Um, what is the best way, Karen asks, to get rid of parasites and get rid of bowel issues? I took Synthroid for years, but stopped about 2 months ago. I'm not sure if I'm doing the right thing. Help, please. Um, and then, I would say, so this requires, again, customized care. When you're dealing with parasites, there's really not a whole lot you can do, even diet related. Like some people will say, well, just add spices to your diet. Well, that parasites don't like certain spices. That's true. Like, um, turmeric, garlic, cumin. Um, parasites don't like certain spices, but it doesn't knock them down enough. And you really need to go through, find out what the likelihood is that you have a parasite problem with comprehensive testing. And then you would need a customized plan to help you deal with those because, first of all, you've got to open up your detox pathways. Secondly, you have to have an agent that will really knock them down and kill them. And then you have to be able to deal with detoxing from the die-off and the the toxins that they've released, the heavy metals sometimes that they've released, because they're harboring those bacteria that they harbor. So, all right. Um, all right, let's see. What other questions do we have? Is there any way to test for water metabolism? Well, yeah, I mean, we see BUN, blood urea nitrogen, on a basic metabolic panel. In our testing, we're able to see in functional comprehensive testing, we're able to see the BUN to creatinine ratio. And when this is elevated and when BUN is elevated, this means that yes, your cells are dehydrated and they're not making the water that they need to make. And you could be drinking a lot of water. You could be drinking plenty, which I recommend, certain amount, half your body weight in ounces typically. But yeah, that could be that is a way to test for, water metabolism. How do you know you need probiotics? Again, you've got to have comprehensive stool testing. What helps with kidneys and with cysts? Um, Strengthening your liver, taking care of a sick liver, dysfunctional liver, is the first way to help the kidneys. And taking care to find out if you have mold toxicity is another big way to take care of your kidneys because mycotoxins will directly affect kidney health and kidney function. Fixing insulin resistance will help the kidneys. Okay. Getting rid of any other toxins. Medications can damage the kidneys. Um, and cysts form on the kidneys when there's something going on, like I said, uh, certain things just irritate the kidneys, right? And that can cause cysts to form. So generally, there's hormone irregularities when you have increased when you have hormone surges that will, and those excess hormones are then cleared through the kidneys, then you can start to develop cysts from that. For example, ovarian cysts are caused by too much progesterone and perhaps sometimes too much testosterone. And that's part of what polycystic ovarian syndrome is too much testosterone. So too much testosterone can also potentially form cysts elsewhere. So opening up your detox pathways again with customized care is so important. Getting comprehensive testing to figure out what's going on is how you even begin that process. And I talk a lot about that during the masterclass. So if you have these problems, that's the key. Attend the class, learn more, okay, and implement. Let's see, how can a probiotic cause harm? Well, because there are additional bacteria introduced into your system that you don't need. If you don't need those particular bacteria, then they can start to overgrow and cause more problems, right? Even though they're beneficial, it's all about the balance. So it's that's the key. It's the balance. Foods that contain probiotics, there no, there's prebiotic foods. So, fermented vegetables are going to be prebiotic. They'll have a little bit of that, but they're mostly prebiotic foods. Okay, that's what you're thinking about. And even too much of that can be harmful if you already have those types of bacteria, and they can, be difficult to digest. Um, so yeah, it's all about getting the right information for your particular system. That's the key. What helps with diverticulitis? Antibiotics. And there can be some natural ones that you could take too, but that's you have to that's typically an inflammation caused by infection in those pockets. I use only essential oils for fragrance. My favorite is frankincense. Is there a need to avoid this? Not unless you're sensitive to it or it's causing a sensitivity. How does Barrett's esophagus relate to Hashimoto's? Hashimoto's causes hypothyroidism. Hypothyroidism causes low stomach acid production. Low stomach acid production leads to refluxing food, undigested food, and partial amounts of, any sort of any acid, lactic acid that builds up with undigested foods, fermented foods, right? The food that doesn't digest in your stomach ends up starting to ferment and and form alcohol as well. That can lead to changes in the lower part of the esophagus, the LES, the lower esophageal sphincter area, and that leads to changes in the skin, the cells there, leading to what we call dysplasia and Barrett's esophagus. That's how that happens. It's not too much stomach acid. That's not how this happens. Is it possible to get off cholesterol meds, Repatha, and ezetimibe? Yes, it is possible. I have patients get off them all the time. What about drinking lemon water? In other words, are there benefits to drinking lemon water? Sure. Yeah, lemon gives you a certain level of acidity, which can help with digestion. It can be similar to taking apple cider vinegar, but it's also uh, it has kind of an opposite or paradoxical effect, and it can actually help with bladder dysfunction when you have, um, like chronic cystitis. Um, there can be certain benefits to that. And then it says, I read that oregano, another question is, I read that oregano potentially may kill molds. Is this true? No, it doesn't kill molds. It kills bacteria and it can help with viruses. How about H. pylori? I'm not sure about the question. Um, H. pylori is it's in the stomach. It'll be typically commensal in the stomach, but it can get out of hand and start to cause ulcers. Um, and I don't know what else. It's a source of possible infection and gut dysfunction. All right. Hi, Sean asks about what about using doTERRA oils? Also, what about decaf coffee or tea? Okay. Um, doTERRA or any other essential oils, these oils are pharmaceutical grade and they can have a pretty strong effect on physiology, like medications can. And they can actually be too strong if you don't necessarily need them. And they can have an opposite effect, can cause side effects, can stress the body. Um, and so I don't typically, I myself don't use a lot of oils. Okay. I've found that they're still much like a Band-Aid, like a medication would be, and they have strong. They're potent. They're potent. So decaf coffee or tea, as far as, yeah, decaf would be much better if the coffee is mold free. Um, I'll give you a couple of brands to check out. Purity Coffee is a mycotoxin or mold-free coffee, and it does come in a decaf version. There's Bulletproof, that's also mycotoxin free. There's Life Boost Coffee, which is certified mycotoxin free. Um, I'm not familiar with any others, and other than maybe some, there's certainly some mushroom coffees that you might consider like Everyday Dose or Atlas Plus, superfoods, Beyond Brew. These might be okay instead. They do have a little caffeine, a lot of them. So just be careful with that because, like I said, caffeine can raise your cortisol. It does raise your cortisol. And it is a diuretic as well. And you might find yourself wasting water instead of keeping it. Um, let's see, Missy asks, hi there. One Wednesday, you mentioned the possibility of high dosage of thyroid medication, maybe why unable to lose weight. Um, and you're taking 150 milligrams of an NDT, natural desiccated thyroid medication, but very, very slowly losing weight. Uh, it's not likely the medication. It's not likely the natural desiccated thyroid. You're working through a process with with our provider and your coach, and there are many other things, perhaps for you, that need to happen first. And then getting rid of mold toxicity is really the key for many of our patients, and it might be for you as well. So this is something that you'll need to probably bring up with your coach and provider, but I can tell you, sometimes the weight is the slowest thing to budge when you're dealing with a lot of toxicity, especially mold toxicity. Don't get hung up on it being the medication, the thyroid medication. It's usually other things, insulin resistance, insulin surges, and dysglycemia. That's one of the biggest reasons for this, for you holding on to the weight and it coming off slowly yet. That can be caused, that insulin resistance and blood sugar problem is likely caused by the toxins. Those have to come out. And if I mean, it is a difficult thing to be patient with the process, but those toxins have to come out enough so that your cells are then free to metabolize and release fat, right? But while you have these toxins and they're not getting, they're not coming out super fast, maybe it's been difficult to open up your detox pathways uh, enough. That's going to be why. They're not coming out as quickly. Those toxins aren't coming out as quickly as you would like them to. And so you're not seeing those results as fast as you would like, but that's why such an individualized process. All right. Will drinking cranberry juice help kidneys and drinking water and lemon water? Um, it can, yes, but cranberry juice is low in sugar. You probably don't even need that. That's probably not something you need. You need to fix these other issues. You need to get the toxins out, probably. Mycotoxins, mold toxins is probably, along with insulin resistance, the biggest factor. Will getting tested help ease the mystery of the connection between Hashimoto's and hives? Yes, absolutely. Absolutely. Because you'll understand if you have any sort of biotoxicity, which is almost always the biggest reason why people get hives, an MCAS, uh, mast cell activation syndrome, right? So I know a lot about that. We've treated a lot of patients for this, and it requires comprehensive testing. It requires you to go through the blueprint that I explain in the masterclass. Will getting an IUD, Marina, or copper adversely affect your thyroid if you have goiters? Um, if you have them or not, if you have goiters or not, it can affect your system. Absolutely. Jane, hi Jane, asks, should I still be using apple cider vinegar before meals while I'm on the metabolic clearing program? Sure. It's never bad really to utilize apple cider vinegar to help you digest. Okay. Where do the biggest mold, where does mold come from basically? Mold is everywhere, ladies. It's outdoors, it's in nature, it's indoors when there's water damage. Uh, any, I share a lot of this in the bonus material that I'll probably share again with this next masterclass coming up. Um, Stay tuned for our announcement. By the way, mold is everywhere, and it's the most common toxin, biotoxin on the planet, other than like bacterial toxins. It's the most um, common one that really causes us a lot of problems. Okay. And Rodora, hi Rodora, asks, can you recommend a home air purifier? I do recommend the Air Doctor. It seems to be one of the most robust and effective systems that I have found. There are a few others that I'm looking into. Um, I may be able to do, in the future, a Wellness Wednesday on that topic, and I will present to you what I found in the research. But I'm looking at a couple of other systems, and so I can let you know what I find. All right, ladies, I think will leave it there. I've come to the end of our time. I've spent a little longer time than thought I would, but here we go. We'll go ahead and end with that tonight. You've had great questions. I know you're motivated. I know you want answers, and so I hope that this Ask Dr. Ed Anything tonight has helped you. And I want you to know that you know you can still have hope, right? There are answers, yes, and you must remember that you still have the power to heal. When we announce the master class, ladies, be ready. Be ready to register and attend and learn more, even if you've attended before. Um, I'm really looking forward to sharing the information I have again during this next master class, and I hope you all join us. Ladies, have a great evening. Thanks for joining me tonight for Wellness Wednesday, and we'll see you real soon. Take care.